Hi, I'm Rob, student physical therapist. This is Ariana, and today we're going to be taking her BMI, which consists of her height and weight. So the first step is to ask your patient to please take everything out of their pockets. Good? Okay, now I'm going to ask her to please take her shoes off. Perfect. And now I'm going to have her stand on the scale facing the wall. And to build rapport with the patient, you do not want to increase the weight, so you want to slowly move the bottom weight. And remember to keep it in pounds, and then smooth the small weight and see if the level stabilizes. And if it doesn't, you want to push the small one all the way back and increase your increment in pounds. And then again, slowly move the top weight and see if it stabilizes. Okay, and it's stabilized. And her weight is 111. So you want to make sure you move the weights back. And Ariana, you can take a step off the scale for me. Okay? And now I'm going to have you step back on the scale facing the window. And I'm going to ask you to keep your heels together and have your feet at about a 60-degree angle. Shoulders relaxed, arms to her side. And if your patient is a bit taller than you can use a stool, because you don't want to hit their head with the lever. So Ariana, I'm going to ask you to take a deep breath in. Okay, and you can take a step off. And she is 4'11 and a half.
The way to document for body mass index is by utilizing the calculation of taking the patient's weight in pounds and dividing that by height in inches squared, then multiplying that number by 703 to receive your patient's BMI. Now the way to interpret the BMI result is by looking at the BMI weight category. There are 4 classifications of weight statuses, which include underweight, normal, overweight, and obese. My patient's BMI was 22 and classifies with the weight status of normal. Another way to calculate BMI is in kilograms over meters, and the equation is listed above. The reason to do the BMI assessment is to get a simple, non-invasive, inexpensive, estimated measure of body fat. BMI can be utilized to screen for weight categories that may lead to health issues. Many studies have displayed that a high BMI can lead to future morbidity, complications to one's health, and even death. It is very important to know that a contraindication of BMI is that it does not measure body fat directly and is not a diagnostic of an individual's health. There are many factors such as age, ethnicity, muscle mass, and other aspects that can play a role in increasing BMI. A high BMI does not necessarily mean that you are at risk for certain health complications that may be seen in patients with a higher weight status, such as overweight or obese. Here are some key points to remember when assessing a patient's BMI. When taking a patient's weight, you want to build rapport with them. A way to do that is to not assume their weight and slowly move the weight until it balances. Also, you want to have them take off their shoes and remove all belongings from their pockets. When taking a patient's height, have them stand straight up, heels together, feet at a 60-degree angle, hands to their side, and to take a deep breath in. Also, you want to make sure their hair is not in a bun to be able to obtain an accurate measurement. You want to have the BMI formula memorized to be able to calculate and interpret the BMI results. Also, additional tests may be needed for some patients because they may be categorized in a weight status of overweight or obese but look like they are at a normal weight. Other tests that may be done can include the skin fold measurement to test body fat, an evaluation of the patient's diet, medical, and/or family history. Lastly, it is extremely important to remember that BMI is not a direct measure of body fat. These are the references I use for my presentation.